Today we will speak an important aspect in the development of the thyroid gland, development of the embryo, an important gland that regulates the energy and metabolism of the human body. The gland is formed initially from the floor of the pharynx, really at the junction of the anterior 2/3 of the tongue with the posterior 1/3 of the tongue. At the junction there is a small dip-like structures called foramen cecum. From there is downward invagination or tunnel-like or duct-like structures that migrate downward and dorsally to be situated in the front of the hyoid bone and the laryngeal cartilages. Then it will differentiate in what's called thyroid gland. This tunnel or this diverticulum is later on will be obliterated or degenerated or atrophied. يضمحل ويختفي. We'll show you initially what I talked about. The anterior 2/3 of the lung anterior 2/3 of the tongue with the posterior 1/3. There is dip-like structures, foramen cecum. There it will be this gland of tissue. It will be differentiated and it will be downward invaginated and migrate downward dorsally to be situated in the front of the hyoid bone, in the front of the cartilages, to form what's called thyroid gland. Far we talked about the normal differentiation and normal development. In certain situation, as this gland is migrating along through from the foramen cecum downward to be situated in the neck, in the front of the laryngeal bone, along this line there may be abnormal development and abnormal growth that will be differentiated to form a cyst-like structure along through this tunnel. That's called THRYGLOSSAL cyst, which is situated at any site from the foramen cecum till the line of situation of the future situation of the thyroid gland. This gland, this picture show you exactly this neck swelling that is situated here in the upper part of the neck. That is it was diagnosed as a case of THRYGLOSSAL cyst. So this case is a THRYGLOSSAL cyst. To suspect any swelling presented from down in the base of the tongue downward, that's shown in this diagram. This is the foramen cecum, and here there is a THRYGLOSSAL cyst. That is when you do diagnosis initially by aspiration of some of the tissues there. When you study it under microscope, we call it histopathological examination. Examination of the tissue under microscope is called histopathological examination. When you study this, you take a tissue from this red spot, that is the swelling. The tissue there can be seen as it is resembling thyroid tissue. That is an ectopic or abnormal swelling. Or abnormal cyst, that is the THRYGLOSSAL cyst. It can be also situated in the here down in the front of a hyoid bone or above the hyoid bone, can be situated down to the hyoid bone, or even sometimes can be found near the gland swelling. So these all are called THRYGLOSSAL cysts. So if you want to talk about now what is this cyst, how it is presented, it can be presented as like a swelling that is with the color of the surrounding tissue, the same color, but also there's abnormal swelling that may sometimes only causing sometimes difficulty in swallowing, or sometimes can cause some cosmetic abnormality. Or this cyst can also present with a complication. ممكن أمورها تتعقد مو بس cyst. Cyst means any swelling that contain a fluid. So it may be there may be normal fluid inside it, or sometimes it may be inflamed تلتهب، يصير بها inflammation. شو يصير بها؟ صار بها inflammation، يصير fever، يصير يعني حمى، يصير swelling، increase swelling of the cyst، يصير بها redness، حمار يصير بها، tenderness يصير يعني وجع ألم، which might bring the patient to you. Sometimes the mother or the father, they can bring a small child with pain in the neck. This swelling is present there for some time, but they brought the baby because of the painful swelling, so it can cause pain. Okay, or so it can be present with complication. So it can present with inflammation, can cause infection sometimes when the inflammation, if not treated, can cause infection. من يصير infection يصير بيها pus، يعني يصير بيها قيح، يصير بيها بالعام نسميه جراحة، يعني قيح من يسمى can be presented as cyst-like structure that may cause pressure on the surrounding tissue، أو ممكن تسوي pain، ممكن يصير swelling increase in size if it is get inflamed. It can cause infection. Sometimes calcification can occur، يصير بها calcification، يعني debris inflammatory debris deposition يصير بها، ويصير بعدين بها calcification، يصير hardness. تجي تجيب لك الأم الطفل تقول لك فد swelling صغير بعدين قام يكبر حتى صار hard، صار يعني قاسي، ممكن يكون because of calcification. Or can cause sometimes kind of breakdown، the skin over the cyst kind of breakdown، يصير في sinus discharge fluid، sinus مثل يعني duct like structures يكون يطلع discharge. So you can suspect this cyst with complication. So how you treat this cyst? Treatment is by surgical removal. لازم يعني استئصال جراحي يسوي لها. For talking about the abnormal thyroid gland growth and development, we talked about thyroglossal cysts, and we said what could this cyst had a complication. The other type is aberrant thyroid gland. Aberrant means ectopic، يعني normally الectopic يعني خارجي، يعني مو في مكانه الأصلي. احنا normally the thyroid is situated in the neck over the thyroid cartilage, but sometimes the thyroid may be situated ectopically along the course of the THRYGLOSSAL duct. That is, sometimes it is situated lingual, that is near the base of the tongue, or sometimes it may be situated the suprahyoid, sometimes infrahyoid. So these are, or sometimes retrohyoid bone. Sometimes أكثر شيء يعرفوها الجراحين طبعا، تشوف من يسوي dissection بدي يشوف بها طبعا goiter means swelling، يعني goiter means abnormal swelling of the thyroid gland. الجويتر هذا من يجي يشيله الجراح شو يسوي؟ مرات يدور خاف اكو retrohyoid development of thyroid. So it is very important removal of thyroid to look for these sites, especially if there is aberrant thyroid gland situation. The other abnormality is agenesis. كل شيء قدامه يعني معناتها ماكو، يعني abnormal it is failed. Agenesis of the thyroid gland, it means that there is congenital absence of the thyroid gland. There is no thyroid gland, or we call it congenital cretinism. Why? This is a very important situation, because thyroid gland is an important gland in the human body. It regulates energy production and also some hormonal evaluation of the calcium level by the presence of the parathyroid gland. So these are the common abnormalities of the thyroid gland. This slide showing THRYGLOSSAL fistula. It is another congenital infection. As we said before, THRYGLOSSAL cysts can present as a swelling, as just a swelling, or sometimes it can be complicated by a sinus discharge. So THRYGLOSSAL fistula can be a complication of THRYGLOSSAL cyst when it is ruptured to the outside, or sometimes after surgical removal. إذا كان الجراح مو كلش delicate enough، لازم كل هذا اللاين مال شفتوه اللي يصير downward growth من الفورامين سيكم إلى حد الثايرويد جلاند، لازم كل هذا يسوي له removal، لأنه يعني خاف يكون أكو بي aberrant، يعني aberrant and ectopic thyroid gland anywhere ممكن يسوي لنا complication. فشلون نفرق أنت هذا الجراح meticulous work، يعني شغل دقيق، من هذه؟ احنا كلكم ان شاء الله بعد تخرجون تصيرون اطباء ويصير قسم منكم جراحين. واحد يتفرق عن الثاني بشقد يكون عنده delicate work، delicate fine meticulous work، يعني شغله نظيف ويدور يعني الاشياء يشتغلها بدقه، لانه مرات الجراحه اذا ما تكون بدقيقه وتحسب حساب للبعيد وكل شيء ممكن تحط ببالك you can get a complication، تاثر على سمعتك. So this one can be a complication. It is not a congenital. The presence of THRYGLOSSAL cyst is a congenital, but a fistula sometimes it can be a complication of THRYGLOSSAL duct, or sometimes maybe a complication of the removal of the THRYGLOSSAL cyst. So it's commonly present during childhood, or that's mainly in the lower of the hyoid, at the lower side of the hyoid bone. So it may be a site of recurrent inflammation and recurrent discharge from the same opening. تقول لك كل مرة مثلا يجوز يتنقلون بالبيبي من أكثر من جراح، من واحد الثاني، ودت الفلان جراح شالها ورجعت مكانها بقى ينبع ويطلع سوائل، ودت الغير جراح. this is very important during surgical removal, that you should be, the message is that you should have a delicate, fine, meticulous work. I show the typical lingual thyroid, which is a congenital condition that is normally, as we said, the gland is situated or originate initially from the foramen cecum near the dorsum of the pharynx, between the junction of the anterior 2/3 and posterior 1/3 of the tongue. From there, the thyroglossal duct will migrate downwards. Sometimes there is failure of migration. The gland itself situated there, lingual, and it can be seen as reddish swelling at the base of the tongue, in the dorsum of the tongue, and this is a very rare condition, congenital type. يعني congenital means presence from the birth, and it is commonly occur in female in rate of frequency، يعني قد هاي تحصل 1 in every 100,000 delivery، واحدة بكل 100,000 delivery، which is rare طبعا, but you should keep it in mind also. Slide show exactly a clinical case of a case with the lingual thyroid. Here a family brought a 12 years old female presented with chief complaint, this is chief complaint of dysphagia. What is dysphagia? Dys means difficulty, phagia means swallowing. So this child is presented with difficulty in swallowing. On direct examination there was a reddish mass about 2 to 3 centimeters situated near the dorsum of the tongue, or the base of the tongue dorsally, and when they did a sample from there, they take a tissue for biopsy, or we call it histopathological biopsy examination. It showed that this is thyroid tissue is there, and when they did thyroid function test, that is the male. What is thyroid function test? It is a test to evaluate the thyroid hormone level, the T3, which is the initial active thyroid hormone, the T4, the inactive thyroid hormone, and the TSH, that is the regulation of the thyroid is initially from the basal, from the higher center, from the brain, from the pituitary gland. So they found the thyroid function test is normal. That means that gland, which is situated lingually, is functioning normal. Okay. Now we are talking about this slide and the previous slide showing variable defects, and I said before that the normal development of the facial development comes from 5 prominence, the single frontal process, 2 maxillary process, and 2 mandibular process. These fuse together forming the face, sometimes as a result of abnormal facial development which occurs partial or incomplete or partial the failure of fusion between the maxillary and the frontonasal sinuses that can present with one or both sides facial abnormality in form of a cleft palate with or without cleft lip. It is a rare condition, more common in females, can occur in a frequency of 1 every 1,500 deliveries, and these defects can present, as I said, sometimes cleft palate, that is mean opening in the palate. You know we have two parts, the hard palate, سقف الفم البون هو هذا, and the soft palate, that is the palatine tonsil wear. Okay, this is the soft palate. So when I said cleft palate, that means there is opening in the palate, that is mean in that hard part. It needs a surgical correction, and the causes of this condition can be can be genetic, and just for genetic abnormality, gene development. Sometimes can be cleft palate with or without a cleft lip, can be a part of a syndrome. يعني اكو genetic predisposition, اكو abnormal genes, but in addition to that there is facial expression, or there is external body demonstrable sign. يعني مثلا يكون عنده genetic abnormality بس وياها اكو عنده cleft palate. Okay, ممكن يكون toxicity or teratogenicity by drugs What is teratogene? You should know what is teratogene, okay? And sometimes these cleft palate with or without cleft lip, يعني شفة الأرنب يسموها الشفة المشقوقة cleft lip. Sometimes this can occur due to use of abnormal drugs during pregnancy, such as anticonvulsant drugs, that is anti-epilepsy. أدوية الصرع ممكن, especially the valproic acid, can cause such condition. Sometimes smoking of the mother during pregnancy may lead to orofacial, oromouth facial defects. So you should keep in mind these drugs, and you should keep in mind genetic abnormality together with clinical syndrome. As we said before, in the fetal development, in the embryonic development, there are mesodermal thickening on each side of the fetal neck or embryonic neck. That is 6 in number on each side, 6 on the right side and 6 on the left side. These are called pharyngeal arches, and they are 6 in number. And as we said before, the 5th arches will obliterated or atrophied. The remaining is 5, from 1, 2, 3, 4 and 6. But with the further development of the embryo, the 4th and the 6th arches fuses together, forming the remaining 4th arches, arch 1, 2, 3 and 4. On the inner side of the pharynx, on the endodermal lining, there is spaces left in between of these arches, or what is called as pouches, which are 4th in number. On the external side of these arches, on the skin side I mean, there are clefts, which are also obliterated with the further development of the embryo. Sometimes these clefts will remaining, forming what's called as branchial cysts. So what is a branchial cyst? Branchial cysts are a congenital epithelial cyst which is present on each side of the lateral part of the neck. They are usually painless, fluctuant, and present on the alongside of the sternocleidomastoid muscles. We can differentiate between a branchial cyst and thyroglossal cyst. The thyroglossal cyst is also a cyst, but it is moved with the swallowing, while branchial cysts, they are not moving with the swallowing. This diagram showing what's the differentiation between the thyroglossal cyst, which is usually present on the, as we said before, it can be present in the front of or upper part of the hyoid bone, or can be present below the hyoid bone, or sometimes retro place of the hyoid bone, that is behind the hyoid bone, while the branchial cyst is present on the anterior part of the sternocleidomastoid muscle. And we can differentiate, as we said, between the thyroglossal cyst. It moves with the swallowing because it is situated on the laryngeal cartilages, that is the thyroid cartilage, while the branchial cyst doesn't move with swallowing. This is all for today's lecture, and thank you.